Hi. I know we have a few people still coming in, and so we wanted to give them just a little bit of time, so thank you everybody for your patience. I'm Carisa Schweitzer-Masek. I'm a counselor here in the immediate office of the Secretary. I have the great honor of supporting the health services portfolio, so that includes HRSA, SAMHSA, and then the Great American Recovery. As I had an opportunity to meet a lot of you this morning, I actually then see a lot of faces that I recognize too that didn't get a chance to say hi to, so hi to all of you. I'll catch as many as I can afterwards. It just makes my heart happy to see all of you. Everybody here is excited just because this is the right thing to do. It's the right conversation to have. Everybody believes, and all of you are working really hard to make a difference and to really work towards those evidence-based best practices. We know that some of you, I met a few that spent the night in the airport and a few that flew in really early this morning. So for those of you that braved the weather, thank you very much for doing that. And that also is just a testament to how important it is to have everybody here today. So on behalf of Secretary Kennedy and the entire U.S. Department of Health and Human Services, I welcome you and thank you for joining our National Behavioral Health Quality and Best Practices Voluntary Pledge event. I'm thrilled to say we have over 30 states, 188 different unique organizations here at HHS, and then a lot more attending virtually, and thank you to all of those that are on our live stream, some of those that are also still stuck in an airport. As a person that has spent their career in the healthcare field, I just want to say your engagement in this event is really important to all of us here at HHS. It's rare to have these various industries and organizations together, and we have individuals representing and I wrote it down so I didn't forget, because some of you I didn't know were going to be here, representing insurers, healthcare systems, obviously the professional medical and behavioral health organizations, state associations, industry partners, tech entrepreneurs. It really just is, again, an example of how everybody's working really hard to make a difference and ensure there is access to behavioral health care. This day marks a decisive and significant step for our country. Under the leadership of President Trump and Secretary Kennedy, HHS is taking a bold, decisive action to reform America's food, health, and scientific systems to identify the root causes of chronic disease epidemic and make America healthy again. Behavioral health is an essential part of that mission. Mental illness and the chronic disease of addiction are treatable, and today we pledge our commitment that they deserve the same urgency, coordination, and model of care of any other disease. This work has never been more important, and it is incredible that we all share this cause. Again, to everyone joining us, we want to thank you for your leadership, your commitment to this work, and I look forward to the rest of the program. I've had a little bit of a preview on what the questions are going to be, and we have a lot of exciting panelists for you today. So for all of you also that are committed to sharing your knowledge, we appreciate all of you today. It is now my pleasure to introduce Dr. Tim Westlake. He is currently SAMHSA's Chief of Staff. He will be your Master of Ceremonies today, and he will guide us through the morning. Please welcome Dr. Westlake to the stage. Thank you, sir.
Good morning, everyone. I'd like to echo what Carisa said. It's my pleasure to welcome you here to the U.S. Department of Health and Human Services for the National Behavioral Health Quality Best Practices Voluntary Pledge event. As Carisa said, I'm Tim Westlake. It's my honor to serve at SAMHSA, and was brought in by President Trump and Secretary Kennedy a few months ago to lead the organization. I spent 30 years in the emergency department, providing care to patients in my community and developing drug and addiction policy at the state level, and I've also been in recovery myself for 29 years. I've been the safety net when care fails and the system breaks down, and sadly sometimes I'm the first and last person that a patient ever sees. It's my passion and my life's work to have an opportunity to shape a national response and improve behavioral health for America all around the country. And today, as Carisa mentioned, you'll hear from Secretary Kennedy. It's a significant leap forward. I'm grateful to guide us through it. We have a packed agenda with a fireside chat, panels, remarks, and a pledge ceremony. So we're just going to get started. Again, appreciate everyone coming in here from around the country, taking the time and energy and effort to be here. It's my pleasure to introduce our opening speaker, Ms. Kathryn Burgum. Ms. Burgum is the White House Senior Advisor for Addiction Recovery and is the co-chair of the Great American Recovery alongside Secretary Kennedy. She has dedicated her life's work to supporting people, families, and communities impacted by addiction. and she continues to inspire us to act with conviction and compassion and help make recovery possible for everyone. Please join me in welcoming Kathryn to the stage.
Good morning. So great to see you all here this morning. Today, you're doing something that may seem very simple. You're signing a pledge that's voluntary. It's not a mandate. It's not a regulation. But history has shown that some of the most important movements begin with a simple commitment, a decision to join together around a shared purpose. Today, that purpose is advancing behavioral health care through a commitment to adopt evidence-based clinical care pathways for screening, treatment, referral, and measurement of mental health conditions and the chronic disease of addiction. And that's why today matters. Because lasting change begins when people choose to move in the same direction. Behavioral health touches nearly every family in America. It includes both mental health and the chronic disease of addiction. While these conditions are different, they often intersect, and they deserve the same commitment to quality evidence-based care and long-term wellness. One of the most encouraging things about behavioral health today is that our understanding continues to grow. Science continues to teach us more. Research continues to improve care. And innovation continues to create new possibilities for treatment, recovery, and healing. As our knowledge advances, we have the opportunity to let that knowledge shape how we care for people. Throughout history, every major advance in medicine has happened because we were willing to let the science change our understanding. Today, behavioral health is experiencing that same opportunity. Now, for me, this work is deeply personal. I know mental health challenges and the chronic disease of addiction through my own lived experience. For years, I struggled with addiction to alcohol. Today, I've been in recovery for over 24 years. Thank you. Recovery changed my life. It gave me back my health, my family, my purpose, and created these opportunities I never would have imagined, like serving as First Lady of North Dakota, and now helping to lead President Trump's executive order called the Great American Recovery alongside Secretary Kennedy. Recovery is real. Every day people recover. Families heal, children get their parents back, and communities become stronger. That hope is what inspires Great American Recovery. Great American Recovery focuses specifically on the chronic disease of addiction. And our mission is to help America fully embrace what science tells us, that addiction is a lifelong, chronic, relapsing brain disease. And we need to build a system for this chronic disease with the same medical approach that we do for other chronic diseases like diabetes and heart disease and cancer. Today's pledge strengthens that entire behavioral health system. Great American Recovery advances one essential part of that system to help transform how our nation understands and responds to the chronic disease of addiction. Together, they represent the future that's rooted in evidence, quality, accountability, compassion, and care. So my hope is that years from now, we will look back on this day as one of those moments when leaders came together and helped create a behavioral health system that delivers better outcomes for millions of Americans. Thank you for making this pledge. Thank you. Thank you for your leadership. And thank you for helping to build a healthier America, one person, one family, and one community at a time. Thank you.
Thank you so much, Kathryn. You're the champion that America needs, and we appreciate your partnership with HHS and with SAMHSA.